which is psychosocial and mental health status assessment. Ano nga ba ito? What is this? What do you mean by psychosocial and mental health status assessment? Familiar na ba kayo dito? So, yan. So, this is a psychiatric mental health component of total client assessment. Okay? So, it is the basis for medical and nursing diagnosis. So, mental status assessment is an organized collection of data that reflects an individual's level of functioning on many levels at the time of the interview. During the interview. Ano-ano ba yan? So, it can be the appearance, the behavior, and the attitude of the patient, as well as the nurse. Isali natin si nurse. Okay? So, in order to effectively assess the client's priority of needs, a holistic view of care should be implemented by the sino? By the nurse. So, whether working in a medical setting or a mental health setting, all nurses need to be aware of psychological, social, cultural, and spiritual issues, as well as ethnicity, sexual orientation, and other information pertaining to the patient. So, yan. So, what else? Physical assessment also, psychosocial assessment also is relevant to understand the patients thoroughly. For what? Anong ganap, di ba? It's in order to provide the best possible care and to help the patient obtain optimal health. So, yon yung ating psychosocial and mental health status assessment. So, ayan. See, meron din pala tayong purposes. Purpose of psychosocial assessment. Okay, 1, to construct a picture of client's current emotional state, mental capacity, and behavioral function. 2, to form a basis for plan of care. 3, to establish a clinical baseline to evaluate effectiveness of treatment and interventions. Ayan. So, the major focus of the mental status assessment is the psychological criteria or stressors that help define the patient's strength, capability from interactions with the environment. So, this includes the ability to initiate and sustain meaningful relationship and to achieve satisfaction consistent with one's sociocultural style. So, those are our purposes of psychosocial assessment. So, next, meron din pala tayong factors influencing assessment. Okay, so the factors that influence assessment are, for example, 1. So, clients' participation and feedback. By the way, so before that, so this, the factors, may naalala lang ako, no? Factors influencing assessment, it matters between the patient and the nurse. Okay? So, it is the patient, ayan, no, sa picture natin, no, si patient and the nurse. So, or the interviewer and the interviewee. Because there are times that nurses needs an information from the significant others then. Okay? So, ayun. So, hindi lang si patient, hindi lang tayo kukuha ng information from our patient. It can be also from the significant others. So, in short, it depends from the factors that factors influencing assessment. It's not only with the interviewer, it's also the interviewee, the patient, and the significant others. That includes. So, ayan. Sige, start na tayo kay client participation or feedback. Okay? So, to complete the assessment, it is necessary for the patient to participate actively. Actively dapat. Okay? So, if the patient is not willing to give information, hindi natin siya mapipilit to answer the questions, the assessment will be incomplete. So, anong gagawin natin? Anong gagawin ni nurse para makipag-cooperate sa patient? Okay? So, yon. So, the nurse need to ask the significant others also or guardian to complete the assessment or gather further information. Okay? So, kung wala na talaga tayong choice, saka natin isasama si significant others. Kung hindi na talaga nagsasalita si patient. Actually, there are factors din naman kung bakit minsan hindi siya nagsasalita. Later, makakasalubong natin siya. Okay? Okay. So, example for this client participation or feedback. For example, the client is irritable. So, may or may not have the mood to answer the questions or complete the assessment, or may have an insufficient attention span, or may be unable to comprehend the question being asked. Yan. Diba? Second, client health status. Okay. So the client health status affect the assessment process. Example, the patient is instantly have a severe panic attack, okay, during the interview. So the patient cannot participate in the assessment for sure. Okay? So with this, the focus of the assessment will be on the current situation. So, it will not be accurate to what is really the purpose of the assessment. 'Di ba? Kasi nung nagsisimula, hindi pa naman siya inatake ng panic attack eh. Inatake ng panic attack. Ayan. Ayan. So, the patient needs to be calm first. Okay? So, because for sure, the patient will only manifest the symptoms of the panic attack, which will alter the result of the assessment. Kasi dyan na tayo nakafocus eh, na hindi naman yun yung purpose ng assessment natin. Okay? So, third, the client's previous experience with and misconceptions about healthcare. So, ayan. So, the patient is reluctant to seek treatment or has the previous unsatisfactory experiences with the healthcare system. So, the patient may have difficulty answering questions directly. Diba? Lalo na kung meron na siyang mga misconceptions about healthcare. Meron siyang hindi magandang experience from the past with the healthcare system. Diba? So, the patient may refuse to provide information. Okay? So, anong gagawin ulit ni nurse? Okay? So, what we need to do with this kind of patient? So, the nurse must address the patient's feelings and perceptions to establish what? Anong kailangan nating establish? Trusting, ganda ng sulat ko. Trusting, ano yan? Sige nga, naalala nyo pa? Trusting working relationship. Okay? So, yan. So, kailangan natin itong i-establish. Diba? Before proceeding with the assessment. Yan. Fourth, client's ability to understand. Kailangan to. This is really a must for the nurse to determine first the patient's ability to what? Nakakarinig ba si patient? Marunong bang magbasa si patient? Nakakaintindi ba si patient sa language mo? Ganon. Okay, halimbawa, waray si patient, katulad ko, at hindi pala naiintindihan yung Tagalog, ganon. Okay? So, it will be difficult for the patient to comprehend ano ba yung tanong ni nurse. So, anong gagawin ng patient? Hindi na siya iimik. Titingin na lang siya sa'yo. Tapos, anong gagawin ni nurse? Ere-record niya doon sa chart mutism. So, na-alter na. Diba? Na-alter na yung result ng assessment. Okay? Because, for example, the truth is, the patient just did not understand the question or what the nurse is saying. So, it is important that the information in the assessment reflects the patient's health status. It should not be the result of what we call poor communication. Ayan. Third, ayan, papasok na tayo. Nurse's attitude and approach. Ayan, so this is really important. Okay? So, this is really necessary to observe. Okay? The nurse's attitude and approach can influence the psychosocial assessment. Okay? So, if the nurse is, halimbawa sabihin natin, always disagreeing with the patient, so the patient may be reluctant in providing information. It is also a matter with the tone of nurse's voice. Diba? Sabi ni nurse or the interviewer, Oh, nurse. Oh, ano ba yan? Oh, patient. Sabi natin si Juan. Juan, ang tagal mong sumagot. My God, nag-aantay na si doktor. Ayun, isinama pa si doktor na nag-aantay na daw, nagmamadali na. So, it should not be. Or di kaya pasigaw, ano ba yan? Ang tagal-tagal. Ayun, di ba? So, with this, for sure, hindi na lang iimik si patient sa'yo, di ba? Sayang. So, with us nurses, we should not in a hurry to let the patient talk. Alam naman natin yung condition nila. Okay? So, any questions so far for these factors influencing assessment? Okay? Okay. Meron pa tayo. How to conduct the interview. How to conduct the interview. So, the patient assessment interview is essential. In what? In gathering critical information about the patient's overall health status. Okay? So it is one meaningful, flexible method of collecting data. Okay? So the interview allows the nurse to use all the senses to explore the patient's behavior as well as specific topics and concerns. Okay? So si nurse, gagamitin yung mata niya, yung pandinig niya, yung all senses. Okay? And remember, the primary instrument to evaluate or the primary instrument of evaluation is the nurse interviewer. So the success of the interview depends on the development of what? Ang sinasabi nating trust. Diba? Kanina pa to paulit-ulit si trust. Trust. Ayan. Rapport. Ayan. So, kailangan natin to. And, respect. Ayan. Okay? So, silang tatlo. Okay? Trust, rapport, and respect between the nurse and the patient. Okay? So, ayan. Start na tayo. Number 1. Provide a comfortable, private, safe environment. So, it's something about the environment. So, the nurse should perform assessment in an area that is safe for both the nurse and the patient. Comfortable and private for both the nurse and the client. Okay? And this will ensure that both are focused on the interview. But class, remember, there are some patients who are manipulative. So, dapat nasa tamang area talaga tayo. Okay? So, conducting an interview is best on where? Example, sa mga conference room. Okay? Or sa merong mga designated area kung saan ginagawa yung interview. Okay? And then, with that, we need them to assure that informations are confidential. Okay? So, tanggalin muna natin si Marity sa ating katawan. Ayan. Kilala niyo yon? I'm sure kilala niyo yon. Second, obtain input from family and friends. But remember, with client's permission. Okay? So, input from family and friends. So, if family members or friends accompany the patient, so the nurse should obtain their perception regarding the patient's behavior and emotional state at home. Nung oras na mga nakasama ni patient, yung mga significant others or yung guardians niya. But, privacy must always be ensured when obtaining this information. Pero class, there are some patients, they don't give permission for the nurse to conduct separate interviews with the family members. Okay? Baka isipin niya, ano kayang sinasabi ng mami ko? Or ano kayang sinasabi nitong friend ko doon kay nurse? Diba? So, yan. There are some patients that they don't give or they don't allow to have a separate interview. But, minsan din naman, there are some na, halimbawa, during the interview, pag tinanong ni nurse directly si significant other, si kapatid or si mami, nakatabi si patient, sometimes they are not comfortable talking about the client in front of their child or something ganyan, 'di ba? May mga pagkakataong ganyan, lalo na kung mga sensitive issues ganyan. Okay, sometimes they just provide limited information. Okay? So, ayan. Third, ask questions that are open-ended or close-ended as needed. So, yan. So, open-ended questions can be used to start the assessment. And as it progresses, questions should be what? Clear, simple, and focused on one specific behavior or symptoms. So, the nurse should use a non-judgmental tone and language when conducting the assessment. Okay? Ayan, so mag-iisip na tayo ngayon. Isipin natin, ano nga ba yung mga open-ended questions? What are examples of open-ended questions? Sige nga, anyone can give an example of an open-ended question? So, example, what brings you here today? Yan. Or, yung common na tinatanong natin, tell me what has been happening to you. Yan. Or pwede ding, how can we help you? Yan. So, those are examples of open-ended questions. But, if the client or if the patient cannot organize, hindi niya na-organize yung thought niya, or has difficulty answering open-ended questions, so the nurse may need to use more direct questions just to obtain an information. Okay? Kasi okay lang naman. So, the questions need to be same pa din. Dapat clear, simple, and focus on one specific behavior. Okay? So, one specific behavior lang. Kung halimbawa about sleep, so about sleep muna yung tatanong mo. Next sentence mo is kung halimbawa about na sa kanyang activity of daily living. So, yun. Hindi na sa isang sentence yan lahat. Example. Kumusta yung tulog mo? Nakakapag-jogging ka pa ba? Nakakausap mo pa ba yung mga pamilya mo? Anong nangyayari sa loob ng bahay? Ayan, natambakan ng question. So, hindi ngayon alam na patient, saan siya sasagot dun sa question niya. Question mo. Okay? So, with that, we should only focus one topic at a time. Okay? So, yun. So, halimbawa, how many hours did you sleep last night? Sasagot si patient. I just sleep around 2 hours. Okay? Have you been thinking about suicide? Sabi ni patient, yeah. Ayun. So, yan. Okay? So, those are close-ended questions. Sample of closed-ended question. So, the nurse also should use a non-judgmental tone and language. Ayan, yun talaga yung importante dyan, no? Non-judgmental tone and language. So, particularly when asking about sensitive issues or information such as what? Like drug abuse or mga sexual behavior or mga violence, ganon. Or kahit minsan yung child rearing practices. So, it's a form, minsan na i-consider siya as sensitive information. Okay? So, using a non-judgmental language avoids giving the client verbal cues to become defensive. Diba? So, example. So, when you ask a patient about, sino nga ba yung patient natin, babae or lalaki? Sige, babae naman tayo. About parenting role. So, the nurse should ask, what type of discipline do you use? Okay? Rather than asking, how often do you physically punish your child? Diba? Mas maganda yung pakinggan, ano po yung mga klaseng pagdidisiplina yung ginagawa niyo sa anak niyo. Okay? Kesa dun sa, ilang beses niyo po siyang pinapalo. O, diba? So, yan. So, alam niyo na, ha? Yan. So, those are how to conduct our interview. So, in conducting interview, we need to consider the environment, the input from family and friends, and in how to phrase questions or rephrase questions. Kung hindi naintindihan ng patient, pwede natin siya i-rephrase. Okay? At gamit lang tayo ng mga light words na hindi siya ganong kalalim na hindi naintindihan ng patient. Okay? So, yan. Okay, interview skills. Questions from how to conduct an interview. Okay, so interview skills. So with this interview skills, so the nurse uses essential time-proven interpersonal technique and communication skills to interact with the patient and the family in a therapeutic manner throughout the interview. Okay? So, wag nating kalilimutan si THERACOM, Therapeutic Communication Technique. Okay? So, THERACOM Communication Technique. Okay? Actually, we have lots. We have lots of therapeutic communication technique. And, alam nyo na yun. 'Di ba? Ang gagaling nyo nga sa mga videos nyo eh, 'di ba? Yan. So, madami tayo, 'di ba? Halimbawa, yung appropriate use of silence, yung mga offering generalists, etc., etc. So, yan. So, practicing lang natin yun. Masasanay din tayo. Yan. So, interviewing skills. We need to start with the addressing the patient by name and introduce oneself and the purpose of the interview. It's really a must. Okay? Kasi sasabihin ng patient, sino kaya itong kausap ko? Diba? So, at first, magpakilala ka at kung ano ka doon. At yung purpose ng interview nyo. Okay? Demonstrate awareness of and respect of the patients and is sensitive to his feelings by assuming a warm and empathetic approach. So, ayan. Listen to what the patient is saying as well as his understanding the themes and omissions. So, kailangan, no? So, we need to listen what the patient is saying. Observe verbal content and non-verbal communication. So, we just not only focus with the verbal content. So, kasama yung mga non-verbal. Nanlilisik na ba yung mata niya habang kinakausap ka? Baka mamaya suntukin ka na, di ba? So, ayun. So, maging alert din tayo. So, ayan. So, allow sufficient time for the interview to avoid a tense, hurried speech. Ito talaga yan na. So, we need to give time to the patient para din makomprehend niya kung ano yung tanong mo. Just ka, baka sabihin mo, dali na, tagal naman ito. Yan. Monitor one's own feelings and anxieties in the patient's interview. So, yan. So, kailangan din natin siya i-observe yung mga feelings and anxieties ng patient. So, use secondary source of information such as the medical history, psychological evaluation, and social history as a supplement to and not a substitute for one's own clinical impression and evaluation. So, yan. So, those are our interviewing skills. So, patient in an acute episodes of their illness are seldom able to make a significant contribution to their history. So, data may be obtained from family members, if possible, from old records, diba? Kung matagal naman pala siyang pabalik-balik na lang dyan. So, kung available siya. Or from other individuals who have been in a position to report on the progression of the patient's behavior. Okay? And the nurse also must be familiar with the behaviors common to the disorder to be able to obtain an adequate assessment of the client. So, dapat alam din natin, di ba, yung familiar tayo with those behaviors common in a specific disorders. Di ba? Alam natin dapat yung about sa schizophrenia, about sa mood disorder, yung sa mga anxiety, eating disorder, etc. Kung ano yung mga signs and symptoms, as much as possible, meron tayong idea. Okay? So, yan. Okay, so start na tayo. So, mental status assessment examination. Naalala niyo pa ba yung sinabi ko kanina about mental status examination? The definition. Ayan. So, this is a comprehensive assessment, includes an evaluation of needs and risk. So, kasama yung needs and risk or mga high risk. Ganun. Okay, halimbawa yung mga risk for something. So, record of current findings that includes the description of the patient's appearance, behavior, motor activity, speech, alertness, mood, cognition. Actually, all of those makakasalubong natin siya dito. Okay, so, start na tayo. Okay, so mental status assessment is a cross-section of the patient's psychological life and represents the sum or total of the nurse's observation and impression at the moment. Okay? It also serves a basis for future comparison to follow or track the progress of the patient's condition. Okay? So, mental status examination refers to the standard procedure used to evaluate the client's mental and emotional functioning at the time the client is seen by the mental health professional. Okay? So, it involves a precise series of observation as well as some eh, sa, sorry, some specific questions. Ayan. Okay, so gathering the correct information about the client's mental status is essential to the development of an appropriate plan of care. Diba? So, the mental status examination is we can call it as a description of all the areas of the patient's mental functioning. So, ito na yan sila. Okay? So, history. So, with the history, the age. Diba? So, it should be the client's chronological age. Okay? Client's chronologic age and developmental stage are important factors in the psychosocial assessment. So, the nurse evaluates the patient's age and developmental level for congruency. Magka-align ba sila? 'Di ba? For example, the patient may have is struggling with personal identity and attempting to achieve independence from his or her parents. So, if the client is 17 years old, so these struggles are normal and anticipated because there are two of the primary developmental tasks for the adolescents, di ba? So, if the client is 35 years old and still is struggling with issues of self-identity and independence, well, now, the nurse will need to explore the situation, okay? The client or the patient age and the developmental level may also be incongruent with expected norms if the patient has a developmental delay or intellectual disability. Okay? Minsan, magkaparas lang yung thinking ng 5 years old at 35 years old. So, ayan. So, we need to check the age and the developmental stages kung same sila. Kung congruent sila with expected norms. Okay? So, we may ask, how old are you? Okay? So, hindi niya nasagot. Pwede na lang sabihin, kailan ka ipinanganak? Para, ayan, di ba? Hindi niya alam ilang taon na siya, pero alam niya kung kailan siya ipinanganak. So, ayan. So, with that, malalaman natin kung ilang taon na si patient. Okay? Cultural consideration, spiritual belief. Okay? So, with this cultural consideration, it's the what? It's the ability to adapt and confront the prescribed norms, what else? Rules, ethics, and more. Okay? Kasi iba-iba tayo ng culture. Lalo na kung halimbawa ibang race, di ba? So, pwede nating itanong, what country did your father came from? Kung halimbawa may lahi siya, halimbawa half-half, halimbawa Chinoy or Chinay. May Chinay. Chinoy, ayan. Diba? So, with regards with our spiritual belief, we can ask, do you have a religious preferences? Ayan. So, according to Bedevic ba yan? So, the nurse must be sensitive to the client's cultural and spiritual belief to avoid making inaccurate assumption about his or her psychological functioning. Ayan. Tama ba? Ayan. It's according to Schultz and Bedevic. So, ayan. So, many cultures have belief and values about the person's role in society or acceptable social or personal behavior that may differ from those of the nurse. Okay? Magkaiba kayo eh. Diba? Halimbawa, yung mga Western cultures generally expect that as a person reaches adulthood, the patient or the person should, halimbawa na lang, become financially independent. So, lalabas na siyang bahay niya, hindi na siya doon titira, may sariling bahay na siya. Okay? He makes his own life decisions, 'di ba? Pero in contrast naman dito sa atin, 'di ba? Kahit may asawa ka na, yung anak mo na, andun ka pa din sama-sama. Okay? Minsan, 3 generations may live in one household, 'di ba? Kasama si lola. Anyway, sometimes din kasi it's a choice, 'di ba? Kaya halimbawa, si nanay at si tatay may isang anak, isa lang, ayaw niyang ihiwalay, nag-asawa na si anak, nagkaanak, andun pa din sila. Sometimes choice din kasi yan, okay? Na sige dito lang kayo para may kasama, lalo na kung tatanda na, di ba? So ayan. So it depends. Okay. And there are some culture na yung mga halimbawa mga eye to eye contact, hindi siya. Okay? So yun, na-observe ko lang halimbawa sa Saudi before na na halimbawa patient namin is lalaki tapos si nurse is babae. Ayan, inililipad siya. Inililipad siya dun sa mga nurses na mga lalaki. Okay? Sometimes hindi naiiwasan kung halimbawa sa ER na madaming patient na doon sa male department. So, yung iba napupunta na lang sa female. Okay? Pero hindi nakakapag eye to eye contact. Okay? Because it's their form also of respect. Okay? Same din sa Japan, di ba? Culture sa Japan, considering the eye contact as a sign also for disrespect, yung nakikipagtitigan ka. Ganon. Anyway, wala tayong magawa-gawa because those are cultures. Okay? So, with the spiritual belief, ayan. So, we can ask the patients about their religious preferences. Okay? Previous history, history of the present illness. Ayan. Singit ko lang yung mga sinasabi nating family history. Okay? So, family history, this is a positive for example, yung meron sa family history nila na merong alcoholism or bipolar disorder or suicide. This is really significant. Okay? Because it increases the client's risk for those problems. Okay? So, the nurse must also consider the client's belief about health and illness, di ba? When assessing the client's psychosocial functioning. So, some people view emotional or mental problems as family concern to be handled only among family members. Wala pa cares yung mga kapitbahay, di ba? They may view seeking outside or professional help as a sign of individual weakness. Okay? Huwag na lang natin ipunta si nanay sa hospital. Ayan. Or sasabihin, baka nung sabihin ng mga kapitbahay. Ayan. Diba? So, others may believe that their problem can be solved within or only with the right medication. Sige na nga, magpapareseta na lang ako kay doctor. Ayan. Gagaling din to. Ayan. Okay? So, they will not accept others' form of therapy. Kasi for your information class, I think na-topic nyo naman ata to with your mental disorder. Meron na ba kayo? Nag-start na ba kayo ng schizo? Kasi, ayan. Or kung any disorder, parang schizo ata yung I'm not sure. Sorry. Sorry. So, ayan. Basta yan. So, meron dun siya. Okay? So, pag halimbawa, si patient needs to take the medication, meron din siyang kaakibat na mga psychotherapy or mga sinasabi nating CBT, yung mga cognitive behavioral therapy, di ba? So, ayan siya. So, aside from medication, it is a must for the patient to engage in those therapies din para mas gumaling si patient. Okay? So, ayan. Anyway, singit ko lang din. Another common problems is the misconception. Di ba? Yung mga pa-misconception natin that one should take medication only when feeling sick. Pag may sakit, inom. Pag wala na, okay na. Remember, class, with the mental disorder, minsan, ilang years yon. Okay? Minsan, lifetime. Okay? It depends on the situation or the case of the patient. Okay? Katulad lang yan ng mga pasyenteng may hypertension. 'Di ba? Diabetes mellitus, 'di ba? Yung mga long-term basis yung medication nila. So same din 'yan especially with the patient with recurrent depression. Okay? They really need to take antidepressant for a long-term basis. So ayan siya. Okay? Question. History present illness. History-percent illness. So, when collecting data about clients with anxiety, so, observe basic characteristics. Ano-ano nga ba yung ino-observe natin kadalasan sa mga patient with anxiety, patient with eating disorder, cognitive disorder, or merong mga schizophrenia, or ano pa ba, sleep disorders, ayan. Okay? There are thought processes, affect, communication, psychomotor, ayun, madami siya later, makakasalubong natin yan. Okay? So, ayan, we have categories of MSE. Okay? Madami sila. Like, general description, emotional state, experiences, thinking, sensorium, and cognition. And, okay. So, for the general description, ay, wait lang. May na-skip ba ako? Wala. Okay lang. Sayang. Okay, for the general description, meron tayong appearance. Okay? Appearance. Okay? Appearance, speech, motor activity, interaction during the interview. So, yun. I-observe natin yan. And, emotional state, mode and affect, with the experiences, the perception, and with the thinking, thought content, thought process. And with the sensorium and cognition, level of consciousness, memory, level of concentration and calculation, information and intelligence, judgment and insight. Okay? So those are categories of mental status examination. Ayan. So, let's start. Isimulan na natin isa-isa yon. Isa-isahin natin yung mga mental status examination. Okay? So, let's start with the appearance. Ayan. Si appearance. Ano nga ba yung appearance ng patient natin? Okay? So, actually, madami sila. Apparent age, so old or younger, manner of dress appropriately, grooming or cleanliness, posture, gait, facial expression, eye contact, pupil dilation or constriction. So, ayan. So, with the appearance, we need to evaluate the client's appearance compared with the chronological age. Andito na naman tayo kay chronological age. Nahihirapan ako pronounce siya. Okay. So, with the chronological age, tingnan natin kung he looks younger or older ba sa age niya. Okay? Yan. So, we can also consider the height and weight. Okay? So, the height and weight. Pwede natin din siyang i-consider. So, we can perform accurate measurements with this. Diba? So, with the grooming. So, grooming and dress. So, we need to note unusual modes of dress. Nakaayon ba sa panahon, 'di ba? Sobrang init pero doble-doble yung damit niya, naka-jacket pa siya. Okay? So yan. So we need to note unusual modes of dress. Evidences of soiled clothing. Nakasuot pa din kahit madumi na siya or labahan na siya or kung ano-ano pa, 'di ba? Or use of makeup na sobra. Okay? Or neat ba si patient? Ayan. So, with regards with the hygiene also, we need to note the evidence of body or breath odor. Ba? And the condition of the skin and fingernails. Ayan, kasama natin yan. Okay? So, with regards with the posture, we can note if the patient stands upright or rigid ba siya or naka-slump over ba siya. So ayan, so we need to consider we need to observe those. Okay? So ayan. So with the level of eye contact, 'di ba? Intermittent ba? Occasional lang ba siyang tumingin sa iyo or walang eye contact na? Okay? Ano pa? Parang nirumble ko 'yon. So yung ayan, sinabi ko na ba dito? Facial expression, happy ba siya or sad? Sige, nagsasalita siya, share siya ng mga sad moment pero happy siya. May ganun. Oo. Okay? So, because we need to observe the general appearance of the patient. Okay? What else? So, yun. Anyway, pwede din natin, halimbawa, observe din natin for the evidences of swelling or mga bruise kung meron siya. Yung mga skin marks pala. Yan, mga distinguishing skin marks. Okay? So, pwede natin siya. Or may mga rashes ba siya? Diba? Kasi baka meron siyang OCD. Diba? Tapos, sugat-sugat na yung kamay niya. Kasi, maya-maya siya naghuhugas ng kamay, maya-maya naghuhugas ng kamay. Okay? So, ayan. So, we need to observe those. Okay, next, speech. With the speech, ayan. So, kailangan nating i-consider si rate, volume, amount, and characteristics. So, ayan. So, we need to observe the speech pattern. The slowness or the rapidity of speech. Ayan. So, we need to note whether the speech seems very rapid. Parang sino ba yung mabilis na tumakbo? Ayan. Pero speech ito, yung mabilis magsalita. Ayan. Na hindi naman normal na para sa kanya sabihin significant others. Ngayon nga lang siya ganyan Ayan, 'di ba? So naiba yung kanyang speech pattern. Okay? And the volume, 'di ba? Is the speech very loud or soft? Okay, or the speech low pitch or high pitch or pabulong na lang, ganyan. Hindi na natin naririnig, lalapit na yung tenga natin. Ayan, sabi natin, sorry, pa-repeat ng sinabi. Ayan, di ba? Kasi hindi na natin naririnig si patient. Kasi it can be the volume of the voice or if it is very low sound, ganyan. Okay? So, kasama na din natin dito yung pressure of speech, di ba? We need to note whether the speech seems frenzied lang or unable to be interrupted, di ba? Ayan. Madami siyang sinasabi. Okay? So, with baka din merong speech impairment sa patient, di ba? Merong hoarseness of voice, slurred speech pala si patient, di ba? Ayan. At yung characteristics din niya, yun yung sinasabi ko, yung speech impairment. And, meron din pala tayong sinasabing aphasia or aphasia, di ba? Familiar ba kayo dito sa term? Aphasia, this is something, meron ba si patient difficulty forming words or use of incorrect words or difficulty thinking of specific words or si patient ba is merong sinasabi na neologism. Mamaya makakasalubong din natin yan, yung making up words. Yan. And the intonation. So, kailangan din pala natin to ma-assess sa patient. Yung intonation. Are words spoken with appropriate emphasis? Ayan. Are words spoken in monotone or without emphasis? Or wala lang, flat lang. Dara-diretso lang yung salita na parang hindi mo alam kung question mark or statement or kung ano yon. So, yan. Okay? So, those are the speech pattern. Okay? Na kailangan natin i-assess with our patient. Ayan. Motor activity. Motor activity. So, level of activity. Is it lethargic, tense, restless, agitated? Okay? Type of activity. Tics, remorse, or grimaces. Unusual gestures or mannerisms, or there is this what we call repeated motors, di ba? So, with the tremors, though the hands or legs tremble, ganyan, ganyan, di pala ako nakikita. Ayan, so, kung nagtre-tremors ba, kung continuous ba yan, or with a specific time only, okay? Yung tics or other, yung mga stereotyping movement, any evidences of mga facial tics, ganyan, or merong mga jerking, di ba? Or merong mga spastic movements, so yan, observe natin yan. There are some patients also na meron silang mga mannerisms or gestures, di ba? So, a specific facial or body movement during conversation, may na-observe ka ba na mga specific facial or body movement? Ayan, nagne-nail biting ba si patient? Kino-cover ba na yung face with the hand? Or may grimacing ba si patient? So, ayan, observe din natin yan. Okay? Or, halimbawa, nagiging hyperactive si patient. Tayo, upo sa upuan. Okay? Ayan. Kahit saan lang siya. Okay? Or hindi siya makaupo ng maayos. So, we need to observe those things. Pwede din yung mga restlessness or agitation. Yung mga lots of fidgeting, yung mga pa-fidgeting niya. Or cleansing hands. Tama ba yung pagka-pronounce ko? Clenching hands. Clenching hands, ganyan. Or aggressiveness. Okay? Overtly angry and hostile. So, pwede natin siya. Or threatening. Or meron ba siya yung mga sarcastic movements. Ganyan. Or yung patient ba natin is merong rigidity or yung halimbawa uupo siya or tatayo siya tapos in a rigid position. Ayan. Yung mga arms and legs ba niya parang naka-stiff lang. Ganyan. And what else in here? For the gait patterns. Ayan. So, sa gait din ng patient, meron bang evidence of limping, ganyan, or limited ba yung kanyang range of motion, okay, yan, or meron pa tayong tinatawag nating ecopraxia, ayan, ano siya, yun yung yung parang ginagaya yung action ng iba, okay. Halimbawa, si nurse nagsasalita at merong hand gesture si nurse, may tinuturo siya. Ayan, nakikita mo ba? So, anong kulay yan? Tapos si patient din gagayahin yung kamay. Okay? So, ayan. Magtuturo din siya. So, ayan. Okay? So, any additional information? Parang nasanan tayo na. Ayan. Okay. Meron pa din dito din sa motor activity, pwede natin yung mga psychomotor retardation din, pwede din siya dito. Okay? Yung mga movement na very slow, ayan. Yun yung tinatawag nating psychomotor retardation. Okay. So, mga movement are very slow. Yung thinking and speech are very slow. Yung posture niya is nakaslump siya, yung ganon. Okay? Yung parang tamlay na tamlay siya, pagod na pagod, ganyan. Okay? Yan. So, question. We should not also forget the range of motion ng patient. Kung we need to note kung meron ba siyang limitation in ability to move. Okay, so kailangan din nating i-observe yung kanyang range of motion. Ayan. So, what is our next? Ito, interaction during the interview. Yan, so interaction during the interview. Ano nga ba yung interaction ng patient? Hostile ba siya? Uncooperative ba siya? Irritable? Guarded? Apathetic? Defensive ba siya? Suspicious ba siya? Or seductive ba siya? Ayan. So, yun. So, interaction with the interviewer. So, ito yung mga action ng ating or reaction, pwedeng reaction ng ating patient. Okay? Okay? Or the interaction with the interviewer. Okay? So, we need to note the general attitude of the patient. Diba? Cooperative or not cooperative or uncooperative. Diba? Does the patient answer the questions willingly or refuses to answer the questions? Ayan. Friendly ba siya? Hostile ba siya? Defensive ba siya? Diba? Is sociable ba si patient and responsive? Or sarcastic ba siya? Or irritable lang? Bawat tanong, pataas yung sagot, ay high pitch yung sagot niya. Diba? Or uninterested ba si patient or apathetic, di ba? Refuses to participate in interview process. Kapapasok pa lang nakatalikod na sa'yo, di ba? So, yon. With that action, makikita natin na the patient is not interested with the procedure, di ba? Ayaw niya makipag-cooperate doon sa assessment na gagawin natin. Okay? Ano pa? Attentive ba si patient or interested? Diba? Kabaliktaran nyo ng apathetic sa patient. Actively participate in the interview process. Sinasabi niya lahat. Okay? Kahit isa lang tanong mo, dami niya ini-elaborate pa niya. 'Di ba? Halimbawa, ano nga ba yung tanong natin kanina? Kumusta yung tulog mo? Maganda yung tulog ko, naka 8 oras akong tulog, naghihilik pa nga ako eh. Nanaginip nga ako, ang ganda ng panaginip ko eh. 'Yon, 'di ba? So, isa lang tanong mo, pero dinescribe niya lahat about sa pagtulog niya. So, yan. Ano pa? Guarded ba si patient or suspiciousness? Okay? Maya-maya ba tumitingin siya sa likod, 'di ba? Yun yung sinasabi nating continuously scanning the environment. Tingin siya sa iyo, tingin sa likod, tingin sa table, kung saan-saan nakatingin, 'di ba? Or pwede ding refuse to answer the question. Ayaw niya. Ayaw yung sumagot sa question niya. So, it's a form of sinasabi nating guarded. Parang may inaiwasan siya. Okay? So, yan. So, those are, pero kung may iba pa kayong ma-observe sa patient during the interview, pwede na naman yung wala dito. Okay? I-note nyo yun. So, yan. Emotional state. So, for the emotional state, we have the mode. Okay? Emotion. So, mode. Ano nga ba yung mga mode ng ating patient? Sad, fearful, hopeless, euphoric, anxious, euphemic. So, ayan. Okay? So, depressed ba si patient? An overwhelming feeling of sadness. Yun talaga yung ating definition ng depression, di ba? Okay? How can you define depression? It's really an overwhelming feeling of sadness. Yan. Or loss of interest in regular activities. Wala. Depressed. Ayan. Or fearful. Demonstrates or verbalizes feeling of apprehension associated with real or perceived danger. Ayan. Pero 'di ba sinabi naman natin before, hindi yung definition pag sinabi nating fear, yung known, alam niya yung kinakatakutan niya. Fear of unknown. Tama ba? Ayan. So, euphoric. Ano pa ba to? Hopeless. Ganyan. So, euphoric ba demonstrates a heightened sense of elation. Ayan. Or expresses feeling of grandeur. Yung parang everything is wonderful. Ganyan. Diba? Anxious ba si patient? Stable ba yung mode state niya? Diba? Manic ba siya? Hypomanic or depressed? Ganyan. Tapos, euthymia ba? Dun sa mga bipolar disorder natin. Yon. So, what else? Halimbawa, irritable. Easily annoyed ba siya? Or provoked to anger? May tinanong ka lang. Ayan, tumaas na agad yung voice niya. Diba? So, elated ba? Merong express feeling of joy and intense pleasure. Or intensely optimistic ba? Yun yung tinatawag nating elated. Diba? Or guilty. Pwede din. Diba? Isama natin yung emotional state, yung mode ng guilty. Okay? So, in here, si patient ba express a feeling of discomfort associated with the real or perceived wrongdoing? Ayan. Or associated with feelings of sadness and despair ba? So, ayun. May ginawa ba siya na merong nag-express siya ng feeling of discomfort in relation doon sa mga wrongdoings niya? So, ayan. Okay? So, those are modes. And same pa din, kung meron pa ding nakita kayo na observe sa patient with the mode na wala dito, pwede naman siyang isulat or isalin niya sa yung assessment. Okay, so affect. So, affect. Ayan. So, affect describes the behavior associated with an individual's feeling state or emotional tone. So, may tinatawag tayong flat affect. Restricted or blunted. Labile. Congruent. Ayan. Diba? Flat. So, there is an absence of outward emotional expression. Diba? So, ayan. Parang wala lang. Ayan. Diba? Pwede din dito yung sa blunted or restricted or pwede din constricted, 'di ba? Yung minimal outward emotion expression is being observed sa ating blunted. Okay? Minimal lang yung mga outward emotional expression. Labay. Paano nga ba sila? Bawa, exhibit mode swing that range from euphoria to depression or anxiety. Diba? Kasi pag sinabi nating euphoric, diba na na natin yung kanina sa mode natin na it demonstrate a heightened sense of elation, yung expresses feeling of grandeur, yung nga ba sabi natin kanina, yung everything is wonderful. Ayan. Okay? Congruent ba with the mode or appropriate ba with the mode? So, yung outward emotional expression is consistent with the mode. Or yung sinasabi nating emotional expression is what would be expected in a certain situation. 'Di ba? Halimbawa, kung depressed ba siya, emotional expression, halimbawa sadness, yung eye ba niya naka-down, ganyan, or nagcry ba siya. Okay? Halimbawa, crying upon hearing of a death. So, ayan. So, it's an appropriate affect or appropriate affect or congruent with the mode. Hindi na ba narinig niya na may namatay pero tumawa siya. Okay? That is inappropriate affect. Okay? So, ayan. Si kabaliktaran siya. Diba? Inappropriate affect. Inappropriate affect when the individual's emotional tone is incongruent with the circumstances. Diba? So, yung example natin kanina dito sa congruent or sa appropriate, yung halimbawa, namatay yung aso niya. Nung narinig niya, umiyak siya, namatay yung aso. Pero dito, nung narinig niyang namatay yung aso niya, tumawa siya. Hehe, bibili na lang ako ng bago. So, it's inappropriate. Yes, oo. Siguro nakapag-adjust siya agad-agad on that moment, diba? Tumawa lang siya na namatay yung alaga niya. So, yun. So, it's inappropriate, lalo na kung close sa'yo or something ganyan. Okay? So, yun. So, question, affect. Okay. Perceptual disturbances. Yan. So, perceptual disturbances. So, dito sa ating perceptual disturbances, we have two types of perceptual problems, yung hallucinations and yung illusion. Okay? So, pag sinabi natin hallucination, those are false. Dito, false sensory perception. Okay? Not associated with the real external stimuli. Okay? And, actually, hallucination, pag yung tao is may hallucination, siya lang yun. It's only the person experiencing unrealistic sensory perception. So, yun siya. So, ano naman pag sinasabi nating illusion? Okay? Illusions are misperceptions or misinterpretation of the real external stimuli. Okay? So, halimbawa dito, paano ba natin ito itatanong? Okay? Does the individual misperceive or misinterpret real stimuli within their environment? Ayan. So, yung tingin niya ba and yung if the patient sees something and thinks it is something else. Diba? Yun yung mga illusion natin, yung sinatawag nating misperceptions. Or, ano pa nga ba? Misinterpretation. Tama ba? Ayan, misinterpretation, of real external stimuli. Okay. Yan. So, balik tayo kay hallucination. Kasi, itong hallucination, those are unrealistic sensory perception. So, pag sinabi nating sensory, ilan ba yung sensory perception natin? Auditory, visual, tactile, gustatory, and olfactory. Okay? So, ayan siya. And isa persecutory. Yan, persecutory. Okay? So, auditory. Auditory muna tayo. So, auditory hallucination are false perception about the sound. Okay? So, yan. So, auditory hallucination are false perception of sound. So, most commonly, they are voices. Okay? But, the individual may report, halimbawa, merong clicks na sound or rushing noise or merong music. Okay? Or other noises. Okay? Ayon. Those still considered as auditory hallucination. Meron tayong tinatawag na command hallucination. Okay? Ano nga ba si command hallucination? Okay? Command hallucination may place the individual or others in a potentially dangerous situation. Kasi may voice dyan, voices that issues command for violence to self or others. Kaya sinasawag na potential danger, ganyan. Or, the patient may or may not be listened to by the psychotic person. It depends. Bahala siyang kung ini-entertain niya or hindi. Okay? Na yung mayroong mga command hallucination. Pero yung command hallucination, those are voices that issues command for violence. Okay? Violence. It can be to self or to others. Ayan. Saksakin mo siya. Ayan. Or talon ka sa building para maging super, ano nga ito? Superman, Spiderman, whatever, ganyan. Diba? So, yun. Those are command hallucination. Okay? So, visual. Alam naman natin if it is visual as hallucination, it's about the visual perception. Okay? It's the visual perception. Okay? So, they may consist of what? For example, mga formed image like halimbawa people or unformed images such as pwede din yung mga lights or flashes, ganyan. Nakakita siya ng liwanag, ganyan. Sabi niya, may nagpakitang liwanag sa akin. Ito na ata yung, ano nga yun? Ang naalala ko, bigla akong naalala yung sa waray na sinasabing kahimayaan. Ano nga ba yun sa Tagalog? So, yun. Yung parang wow, nasa heaven ba, ganyan. Kaya yung mga flashes or may mga lights. Kaya other than nakakakita siya ng mga images. Pag sinabi nating formed images, mga tao yung nakikita niya. Pero pag sinabing unformed images, yun yung mga flashes or mga lights. Okay? Sige na, sulat ko para hindi natin makalimutan. Merong mga formed images or meron din tayong mga unformed images. Okay? Baka sabihin natin na yung sakop lang ng visual hallucination is nakita siya ng mga tao or mga kung sino-sino dyan. Okay? Kasama na yung mga unformed images. Yan. So, visual. So, ayan. So, paano natin to dito? So, is the patient seeing images that do not exist? So, ayan. So, record natin kung anong response ni patient. Okay. So, tactile. So, when we say tactile, ito yung tactile hallucination. Those are false perception of the sense of touch. Okay? So, sense of touch naman tayo. That is often of something on or under the skin. Halimbawa, naramdaman ng patient na may gumagapang o may nakita siyang gumagapang, ganyan. Okay? So, one specific tactile hallucination is what we call formication. Dito na lang. Formication. Tama ba? Formication. Ayan. So, yung formication, it's the sensation that something is crawling on or under the skin. Okay? Halimbawa, mga snakes or mga insects na gumagapang or nasa ilalim ng skin niya. Okay? So, that is formication. Okay? So, paano ba natin to i-ask sa patient? Halimbawa, does the patient feel unrealistic sensation on the skin? So, ayan. That is tactile. Gustatory. Or this is the false perception of taste. Yan. So, most commonly, gustatory hallucination is described as unpleasant taste. Yun lagi yung description ng patient. Unpleasant. Okay? So, does the individual have a false perception of an unpleasant taste? So, ayan. So, ayan. Sasagot na si patient. Okay? Olfactory. Sige nga, ano nga ba si olfactory? And so, olfactory hallucination are false perception of the sense of smell. Ayan, sense of smell naman. Okay? May mga naaamoy na siya lang ang nakakaamoy. Diba? So, does the patient smells odor that do not exist? So, siya lang yan. Okay? Persecutory or yung tinatawag natin ano nga to? Persecutory or delusion of persecution. So, the individual feels threatened and believes that others intend harm or persecuting towards him. Okay? In some way. Okay? So, ayan. So, persecutory. So, question with our perception disturbances. Okay, we'll go to the next. Thinking. So, thinking, meron tayong thought process. So, this is a specific meaning expressed in the patient's communication refers to what the patient actually thinks. Okay? So, this refers to how the clients think. Diba? So, the nurse can infer a client's thought process from speech and speech pattern. Okay, so meron din tayong halimbawa thought content. Thought content refers to how the patient's self-expression, which is observed in the patient's speech, refers to what the client actually says. Okay? So, pag sinabi natin ditong thought content, so what is the client actually says? Okay? What is the client actually says? Yan. So, the nurse assesses whether the client's verbalization makes sense. That is, if ideas are related and flow logically from one to the next. Okay? So, yan. So, tayo here, nurses, so it is a must also to determine whether the client seems preoccupied. Okay? As if talking or paying attention to someone or something else. Diba? So, when the nurse encounters patients with marked difficulties in thought processes and content, so the patient may find it helpful to ask. So, he or she may find it helpful to ask focused questions requiring short answers only. Okay? So, yun about thinking. So, ito na siya. So, thought processes descriptors. Okay, we have delusion. Delusions are false belief that is firmly maintained, even thought it is not shared by others and is contradicted by the society. Okay, so delusion. Delusion, those are false, fixed personal belief. Okay, that are inconsistent with the person's intelligence or cultural background. Okay, so what else for the delusion? It cannot be changed by reasons or rationality. Ganyan. Okay, so and the individual continues to have the belief in spite of obvious proof that it is false or irrational. Diba? So, yan. So, with the delusion, we can ask, does the person have unrealistic ideas or belief? So, yan. Religious. Ito na siya. Religious, somatic, grandiose, paranoid, thought broadcasting, and thought insertion. So, yon. Okay. So, with the religiosity. Religiosity, it's an excessive demonstration of or obsession with religious ideas and behavior. Okay? So, because individuals vary greatly with their religious belief and levels of spiritual commitment, so religiosity is often difficult to assess. Okay? Hindi natin masyado siyang nadidig or nahihirapan tayong mag-assess. Okay? Lalo na because maybe it's their religious belief. Diba? So, the individual with schizophrenia may use religious ideas in an attempt to provide rational meaning and structure to his or her behavior. Diba? So, religious preoccupation may be considered as manifestation of the illness na. Okay? Yon. Somatic. So, somatic, one's body or part of the body's disease. So in here, the individual has a false idea about the functioning of his or her body. Diba? Halimbawa, yung mga nagmenopause na or yung matatanda na. Sasabi niya, I am 60 years old and I will be the oldest person ever to give birth. Okay? The doctor says, I am not pregnant, but I know I am. Ayan. Diba? So, it's somatic. Grandiose. Possession greatness has a specific favor. So, in here for the grandiose, it's an idea that he or she is all-powered or all, sabi na natin, powerful or of great importance. Okay? Yung mga kadalasang sinasabing, I am the king, I am the president of the Philippines, I am the king, and this is my kingdom. Ganon. I can do anything. Yan. So, yan. So, grandiose. Or yung tinatawag nating delusion of grandeur. Okay? Delusion of grandeur. Same lang siya. Okay? So, ayan. So, delusion of grandeur, this is, the individual has an exaggerated feeling of importance, power, knowledge, or identity. So, yun yung ating delusion of grandeur. Ito na, paranoid or excessive suspiciousness. Okay? So, paranoia. So, individuals with paranoia may have extreme suspiciousness of others and of their actions or perceived intentions. Ganyan. Halimbawa, binigyan mo siya ng pasalubong, binigyan mo siya ng food, halimbawa duty kayo kahapon, sa nagkakilala na kayo kahapon, tapos in the morning, ang hirap magsalita, kinaumagahan, pagka duty mo, dinalhan mo siya ng food, ayan, tapos sasabihin niya, I won't eat this food, I know it has been poisoned, or you are going to poison me, or I know it has been poisoned, ganyan. Okay? So, yon yung paranoia. So, yan. So, thought broadcasting known by other people. So, thought broadcasting, this is a delusional belief that others can hear or know what the client is thinking. So, yan. Okay? So, known by other people. Thought insertion. Placed into his mind by others. So, thought insertion. So, this is also a delusional belief that others are putting ideas or thought into the client's head. Okay? That is, the ideas are not those of the client. Okay? So, yun. Kaya, literal, no? Thought insertion. So, yan. Okay? So, meron din tayong sinasabing, thought withdrawal, 'di ba? Thought withdrawal. Tatlo tong thought broadcasting, thought insertion, thought withdrawal. Ayan. Dito na lang natin lagay. Ayan, thought withdrawal. So, a delusional belief that others are taking the client's thought away and the client is powerless to stop it. 'Di ba? Literal din na wini-withdraw. Okay? So, yan. Yan yung ating thought withdrawal. Okay? So, meron pa ba tayong additional information about sa ating sample ng delusion? Okay. Any questions so far? Okay, depersonalization. Okay? So, depersonalization, lost self-identity, things are different, strange, and unreal. So, depersonalization, this is an altered perception of self. Okay? Ayan na. Altered perception of self. So, this is an unstable self-identity of an individual that may lead to feeling of unreality. Okay? Okay. So, example, feeling that one's extremities have been changed in size. Ganon. Or halimbawa, or a sense of seeing oneself from a distance. Ganyan. Yan yung ating mga depersonalization. Okay? So, paano natin dito? Halimbawa, the individual verbalizes feeling outside the body. Diba? Or verbalizing himself far from afar, ganon. Okay, that is depersonalization. Then, hypochondriasis. Hypochondriasis, over-concern, morbid attention to details of body functioning. So, hypochondriasis, this is a preoccupation with the fear that one has a serious illness. Or yung sinasabi nating disease conviction. Okay, actually, dalawa ang kasama dito sa ating hypochondriasis. Yung tinatawag nating disease conviction, and meron din tayo disease phobia, no? Ayan. So, pag sinabi nating disease conviction, ito yung sinabi ko kanina na fear that one has a serious disease. Okay? It's a preoccupation of the mind. Preoccupation with the fear that one has a serious disease. That is disease conviction. Pag sinabi naman natin disease phobia, so it's a preoccupation that a person will get a serious illness or serious disease. Ganyan. Okay? Preoccupation that a person will get a serious disease. That is disease phobia. Okay? So, it is, in short, sa ating hypochondriasis, this is a thought that clients with this disorder interprets body sensation or functions. Diba? Kahit na putol na paa niya, feeling niya andyan pa din. Sabi niya, ang sakit ng kalingkingan ko. Ayan. Na? So, ayan. Okay. Ideas of references. Ideas of incorrect interpretation of incidents and external events as having direct personal references. So, ayan. So, when I say ideas of reference, clients inaccurate interpretation that general events are personally directed to him or to her. Okay, halimbawa, hearing a speech on the news and believing the message has personal meaning para sa kanya. Diba? Kaya siya sinabing ideas of reference. Okay? Yan. Ideas of reference are less rigid than delusion of reference actually. Meron din kasi tayong tinatawag na delusion of reference. So, nakakabatang kapatid yung ideas of reference. Okay? Less rigid lang yung ideas of reference. So, tinatawag nating delusion of reference. Okay? Sige, define na lang din natin or yung ating sinasabag nating delusion of reference. Okay? So, pag sinabi nating delusion of reference, in here, all events within the environment are referred by the psychotic person to himself. Okay? Ayan. So, yun yung pinagkaiba nila. So, ayan. Kasi dito, sa delusion of reference, yung inuugnay niya talaga sa sarili niya. Okay? What else? Magical thinking. Okay. Magical thinking. Thinking equates with doing, lack of realistic relationship between cause and effect. So, magical thinking, with this, the person believed that he or she thought or behavior have controlled over specific situations of or people. Halimbawa, mother who believe if she shout at her son in any way, he would be taken away from her. Ganyan. So, mga pa-magical thinking yan. Magical thinking is common in children. 'Di ba? Yung mga sinasabi nating um, paano nga ba to? In a question, is the person speaking in a way that indicates his or her words or actions have power? So, yung pwede natin siya i-assess in that way. Okay? So, yan. So, question from this thought process. Meron pa tayong sinatawag na nihilistic ideas. Okay, so what is this? So, it's a feeling on thoughts are non-existent or hopeless. Ayan. So, dito sa ating nihilistic ideas, an individual has a false idea that the self or a part of the self or others or the world is non-existence. Okay? Non-existence. Or non-existent. Ba? So, a belief that he or she or a part of the body or even the world does not exist. Okay? Or has been destroyed. Ayan. So, that is nihilistic ideas. Ba? So, example, the world no longer exists. Ayan. Okay? Or I have no brain. Ganyan. Okay? That is nihilistic. Okay? It's not only with the self, but pwede din part of the self or pwede din from the others or from the world in self. Okay? Ayan yung ating nihilistic ideas. Obsession. Ayan. Obsession, idea, emotion, impulses that repetitively and insistently forces itself into a consciousness. Okay? So, obsession. So, in here, a patient characterized by obsession or by reoccurrence of persistent unwanted thoughts or images. Diba? That cause the person intense anxiety. So, ayun si ating obsession. Okay? So, is the person verbalizing about the persistent thought or feeling that he or she is unable to eliminate from their consciousness? So, ganyan. So, yun yung pwede nating parang question form para masagot ni patient. Okay? Obsession. Phobia. Yan, madami tayo neto, di ba? Phobia, a morbid fear associated with extreme anxiety. So, is there evidence of irrational fear? Di ba? Pag sinabi nating irrational fear, it pertains to the specific object or social situation. Actually, we have lots of phobia. Di ba? Meron tayong zoophobia, pyrophobia, may somniphobia, claustrophobia, meron pang microphobia. Naalala ko. Naalala ko, pinanood ko yung ano nga yun? Oh my God, nakalimutan ko. Nakalimutan ko. Parang may virus or what. Saka na lang, pag maalala ko ulit, yung movie yun about fear of germs na siya, sa Japan. Ayun. So, tutok tayo nun sa pagbabasa ng mga sinasabi nila. Okay? So, ayan siya. Okay. Sige, pag maalala ko ulit, pag magkita tayo, or i-message ko na lang, hanapin ko na lang siya. Ayan. Okay? Ang ganda nung movie, kasi parang talaga, realistic. Nakikita talaga natin paano siya natatakot dun sa mga germs. Ayan. Okay, question. Okay, circumstantial. Okay, meron pa tayong circumstantial. Thought and speech associated with unnecessary details that is usually relevant to the question and an answer is ultimately given. Okay, so circumstantial. So with this, the individual is delayed in reaching the point of the communication. It's because of unnecessary or tedious details. Diba? So, the point or goal is usually met but only with numerous interruption by the interviewer. That is to keep the person on track. 'di ba, of the topic being discussed. So ayan. So what is in this circumstantiality? So, meron ba ditong verbalizations are lengthy and tedious and because of numerous details. So, there is this delayed reaching the intended point. Okay? Yun yung ating circumstantiality. Okay? Hindi na matumbok. Ayan. Flight of ideas. Okay? Flight of ideas. This overproductive speech characterized by rapid shifting from one topic to another, or ideas are fragmented. Okay, so flight of ideas. So there is this verbalization are continuous and rapid at yung flow from one topic to another. Okay, na ano nga yun? Na jump. Okay? So, flight of ideas, those are excessive amount and rate of speech, composed or fragmented, or meron ding mga unrelated ideas. Okay? So, yan si ating flight of ideas. Loss of association. So, lack of logical relationship between thoughts and ideas that renders speech and thoughts inexact, vague, diffused, and unfocused. So, yan. So, in here, thinking, associative looseness or thinking is characterized by speech in which ideas shift from one unrelated topics to another. Yan. Okay? Baka sasabihin nyo, flight of ideas ba yan? It's not. It's a loss of association. Okay? So, with this, the individual is unaware that the topics are unconnected. Diba? So, when the condition is severe, speech may be incoherent. Sample. Paano nga ba sample natin dito sa associative looseness? We wanted to take the bus, but the airport took all the traffic. Diba? Or driving is the ticket when you want to get somewhere. Ano daw yun? Or no one needs a ticket to heaven, ganyan. Or we have it all in our pockets, yung ganyan. So, yung buong statement niya, unrelated siya sa bawat isa. Ayan. Okay? So, verbalization here shifts from one unrelated topics to another. Okay? So, ayan. So, ano pa ba sa ating loss of association? In here also, there is this disorganized thinking and jump from one idea to another with pwedeng little or no evident relationship between the thoughts. Pwedeng meron konti or wala talaga. Okay? That is loss of association. Okay. Andito na tayo kay neologism. Di ba sinabi ko to kanina na new words or words created by the patient, often a blend of words. So, siya lang yon. Okay? So, the psychotic person invents new words. Okay? That are meaningless to others but have symbolic meaning to the person or to the patient. Diba? So, the individual is making up non-conscious, yung sinasabi nating nonsensical sounding word, diba? Which only have meaning to the patient. Yan. So, siya lang may alam nun. So, paano natin to gagawin in our assessment? So, does the client use neologism? So, si patient ba nag-invent words that have meaning only to him? Ganyan. So, that is neologism. Perseveration. So, perseveration, involuntary, excessive continuation, or repetition of words or of a single response, idea, or activities may apply to speech or movement, but most often verbal. So, ayan. So, perseveration. Okay? So, the individual who exhibits perseveration persistently repeats the same word or ideas in response to different question. So, yon. So, dito sa ating perseveration, persistently repeating the last word or a sentence is spoken to the patient. Example, Paano natin, sige, example natin si patient. Ask natin, sino nga ulit si patient natin? Si Juan. Juan, did you take a bath? Sasabihin naman ni Juan, bath, 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 bath. Ayan. So, perseveration. Excessive continuation or repetition of words. Ayan. Ulit-ulit lang niya. Okay? That is perseveration. Tangential or tangentiality, same lang sila. Okay? So, similar to circumstantial, but the person never returned to the central point or never answered the question. So, ayan. So, dito, this really differs to this is different from perseveration. Tangentiality is different from circumstantiality, 'di ba? Yung kanina natin. So, doon kasi the person person never really gets to the point of the communication. So, unrelated topics are introduced and the original discussion is lost na. So, verbalization that are lengthy and tedious and never reach an intended point, yun yung sinasabi natin kanina sa ating circumstantiality. So, in tangential thinking, so this is this wandering off the topic and never providing the information requested. Okay? Ayan siya. Tangentiality or tangential. Okay. So, next natin is thought description. Okay. Tama ba? Nasa tama pa ba ako? So, thought blocking or sudden stopping in the train of thought or in the midst of the sentence. So, from this word, block. Okay? Actually, this is different from mutism, yung hindi talaga siya nagsalita or does not speak. Okay? So, dito sa ating thought blocking, really the patient stop abruptly in the middle of a sentence or habang nag-uusap sila, huminto lang siya. Or sometimes the patient unable to continue the idea. Okay? Yan yung ating thought blocking. Word salad. Ayan. Alam na natin to. Salad. Okay? It's a combination of words, di ba? So, salad. Word salad, it's a group of words that are put together randomly without any logical connection. Di ba? Using a mixture of words that have no meaning together. Ayan. Or sounding incoherent or flow of unconnected words that convey no meaning to the listener. Di ba? So, halimbawa, paano tayo mag-example ng ating word salad? Yun, basta, combination siya. Parang nahirapan akong mag-example, gumawa ng sample statement ng word salad. Combination of unrelated topic. Okay, yun. So, halimbawa, most forward action, gross life, double play, circle, uniform, ganyan. Car, BSU, kasamang BSU. So, yun, word salad. Okay? Suicidal assessment question. Dito na tayo sa ating about assessment of suicidal or harm towards self. Ayan. So, suicidal assessment questions is the patient have ideation, plan, method, access, where, when, and timing. So, ayan. So, the nurse must determine whether the depressed or hopeless client has suicidal ideation or mayroon siyang lethal plan. Diba? So, the nurse does, ano nga ba ito? The nurse may ask the client directly, do you have thoughts of suicide? Or, what thoughts of suicide have you had? Ayan. So, pwede siya. Okay? So, with this, pwede din natin, is the individual experiencing ideas or harming self or others? Ganyan. Is the patient expressing ideas of harming self and others? Does the patient have a plan? Diba? So, does the patient have access to the identified means for his plan? Diba? So, yan. How strong is their intent to die? So, pwede, diba? So, yan. So, with this 7, dami nating itatanong or i-observe sa patient. So, ideation, are you thinking about killing yourself? Yon. So, sa plan naman, do you have a plan to kill yourself? Ayon. So, with the method, how do you plan to kill yourself? Access. How would you carry out this plan? Do you have access to the means to carry out the plan? Diba? Ayon. Where? Where would you kill yourself? And kailan? When do you plan to kill yourself? And what day or time of the day do you plan to kill yourself? Ayan, yun yung mga direct questions talaga na itatanong natin sa patient natin. Okay? So, question. Ayan. So, ideation, plan, method, access, where, when, timing. So, those are questions na itatanong natin sa patient. Dapat hindi natin makakalimutan. Baka makalimutan natin yung access. Baka makalimutan natin yung how would you carry out this plan. Diba? So, yan. So, dapat yung 7 complete. Ayan. Buo siya. So, yan. So, yung mga sample natin dito kung halimbawa naman with others. So, what thoughts have you had about hurting Juan or hurting yourself? Diba? So, what is your plan? Ayan. So, kung halimbawa naman sa mga friendship niya, what do you want to do to Miguel? Ayan. Di ba kaibigan ba ni Juan si Miguel? Pedro pala. Ayan, nakalimutan ko sa yan. So, yan ha. So, pag mag-formulate din tayo ng mga questions, it should be direct. At kung magtanong tayo, yung dire-diretsong tanong din. Okay? Kasi alam din yan ng patient kung hesitant din tayo magtanong. So, yan. Okay. But, sometimes, if the patient is quiet, so we need to wait for the patient to talk. Huwag nating madaliin. Dali na! Yan, sasabihin natin, sagot! Ayan, di ba? Baka suntukin ka pa ni patient. So, maybe, if the patient still not answering with your question, maybe nagpa-process pa siya kung anong isasagot niya, di ba? So, with this, we really need to establish yung sinasabi natin kanina, trusting relationship, di ba? Yan. Okay. Sensorium and intellectual process. Okay, so in here, level of consciousness. So, with the level of, level of consciousness, orientation, with the orientation, time, place, and person, memory, ability to recall past and present experiences, and the remote, recent, or immediate. Is it remote, recent, or immediate? So, with the level of consciousness, or pwede na natin sabihin, level of alertness, di ba? Level of alertness or consciousness, orientation, attention span, recent and remote memories, concentration, ability to comprehend and process information, and what is intelligence. Those are included in our sensorium and intellectual process na kailangan nating makuha sa patient. Okay? So, level of consciousness. Is the individual clear-minded and attentive to the environment? Ganon. Or is there disturbances and perception and awareness of the surroundings? Ayan, i-observe natin yan sa patient natin. Okay? So, confused ba si patient? Sedated ba si patient? Stuporous ba si patient? Yan. So, with the orientation, it refers to the client's recognition, then sa time, sa place, and sa person. Okay? So, that is knowing who and where he is or where she is. Okay? Kung tama ba yung day, yung date, yung year. Diba? So, this is often documented as oriented times 3. Kung naalala nyo yung natin before sa neurologic assessment, diba meron tayong oriented times 3. So, ayan. So, occasionally, meron din tayong yung mga oriented plus 1. So, ayan. So, paano nga ba yun? So, pag halimbawa, documented as oriented times 3, sige na nga, oriented, example lang to, oriented times 3. So, ibig sabihin, alam ni patient yung day, yung date, at yung year. Halimbawa, may tinanong ka about dito. So, nasagot niya yan. So, anong ilalagay natin sa chart? Oriented times 3. Okay? Occasionally, a fourth sphere situation is added whether the client accurately perceive his or her current circumstances. Ganun. So, absence of correct information about person, place, and time is referred as disorientation or yung sinasabi nating oriented times 1. Okay? So, halimbawa, person only or halimbawa, time only. Halimbawa, isa lang. Halimbawa, day lang. So, yan, times 1. Kaya, kung halimbawa, oriented, parang hindi ko na to nasunod-sunod Halimbawa, oriented times 2. Halimbawa, date and year lang. Kung halimbawa, nagtanong ka, kailan yung birthday mo, ang alam lang niya, date and year. So, oriented times 2 lang siya. Okay? So, yan. Okay? Question. So, when a person is disoriented, he or she first loses track of time, then place, then finally the person. Okay? So, yun. So, magiging disoriented na si patient. Started with the time, with the place, and the person na siya. Okay? So, orientation returns in the reverse order. Pwede ding first, the person knows who he or she is, then realizes the place, then finally the time. Okay? Alam niyang nasa hospital siya at anong araw today, sinong kasama niya, sino siya. So, ayan. Okay? So, disorientation is not synonymous with confusion, remember. So, a confused person cannot make sense of his or her surroundings or figure things out even though he or she may be fully oriented. Okay? So, magkaiba. Si confused person at yung disoriented person. Yan. Memory. Memory, ability to recall past and present experiences. So, it depends if remote, recent, or immediate. Okay? So, the nurse directly assess the memory, both recent and remote. Ngayon at kahapon or nung unang araw or nung nakaraan pa, nung unang taon, 'di ba? By asking question with verifiable answer. For example, if the nurse asks, do you have any memory problem? So the client may accurately respond, no. So the nurse cannot verify that. So similarly, if the nurse asks, what did you do yesterday? O, diba? So the nurse may be unable to verify the accuracy of the client's response. Hence, question to assess memory generally include what? What is the name of the current president? Who was the president before that? Okay? In what country do you live? Or what is the capital of the Philippines? Diba? So, yung ganon. So, with that, alam natin yung sagot. Pero kung tatanungin nyo siya, anong ginawa nyo kahapon? Siyempre, kung halimbawa sabi niya, naalala nyo pang ginawa nyo kahapon? Hindi. So, with that, hindi mo din ma-assess kung talagang hindi nga niya alam. Pero kung halimbawa yung mga pa-question na verifiable naman yung sagot, it is much better na yun yung gamitin natin in questioning the patient or asking the patient. Okay? So, yan. Yun ang ating memory. Level of concentration. Okay, for the level of concentration and level of calculation, diba, social? So, level of concentration, ask client to perform certain tasks. Level of calculation, ask the patient to do simple math. Okay? So, in the ability to concentrate, so the nurse assess the client's ability to concentrate by asking the client before certain ano nga bang sinasabi ko? My God, hala, nag-ano na ba ako? Nawawala na ba ako? Jumping from one topic to another? Hindi naman. Okay? Nasa ability to concentrate pa din naman tayo. Okay, mali lang yung word na nasabi. Oh, balik tayo, balik. Okay? Ability to concentrate. The nurse assesses the client's ability to concentrate by what? By asking the patient to perform certain tasks. Example, ipa-spell mo yung name niya. 'Di ba? Or halimbawa magpa-count ka 1 to 10. Halimbawa in a backward manner, halimbawa 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay? So ayan. Ayan, 'di ba? So that is called pwede din pa-subtract. Pinag-math. Oo, ayan. Basta anything para ma-check natin itong level of calculation ng patient, pati level of concentration ng patient. Kung nakakapag-concentrate ba siyang mag-isip. Diba? So, yun. So, pwede din nating i-ask yung about days of the week. Yung mga simple ganun. Diba? Imposible naman hindi niya alam. Halimbawa, sinabi, in a backward form, kung halimbawa dito sa atin, starts tayo ng Monday, ends ng Sunday. So, mag-start tayo Sunday, Saturday, Friday, ganon. Okay? So, that is called serial 7. Ayan. May sinasabi din kasi tayong serial 7. Okay? Yung halimbawa, subtract 7. Halimbawa, 100 minus 7. Ayan. So, anong sagot? 93 minus 7. So, ganun. So on and so on. Okay? So, yun yung mga pwedeng sample na pwedeng gawin natin sa ating patient. Okay? Pwede din, for example, performing certain task. Halimbawa, stand or magpasulat mo yung name niya or pa-spell. Yung mga ganun. Mga certain task lang. Simple task. Kung kaya niya. Okay? Nung nakakapag-concentrate siya. Okay. So, meron pa tayo information and intelligence. Ayan. Educational attainment. Okay, general fund of knowledge, use of vocabulary, ability to conceptualize abstract, or interpretation of proverbs, and similarity of objects. So, ayan, those are included na i-assess natin dito sa information and intelligence. So, for the halimbawa, yung mga abstract thinking and intellectual ability. So, when assessing intellectual functioning, so the nurse must consider the client's level of formal education. Okay? Huwag din nating pilitin. Okay? Baka hindi nga si patient nakapag-aral. Diba? Lack of formal education could hinder performance in many tasks. Okay? In this section actually of the assessment. Kasi nga kailangan natin dito yung educational attainment. Paano kung wala? So, diba? So, the nurse assesses the client's ability to use abstract thinking. So, which is too many associations or interpretations about a situation. Okay? Or something about a phrase or a comment. Yan. So, the nurse can usually do so by asking the client to interpret a common proverb. Halimbawa, yung mga sinasabi nating yung mga common proverbs natin. A stitch in time saves 9. Ayan, di ba? So, if the patient can explain the proverbs correctly, or the patient's abstract thinking ability is intact. Okay? Katulad na lang nung proverbs natin, yung verse natin kanina na sinabi, di ba? Yung cast all your worries, ganyan. Okay? Kung kaya ba ni patient, i-explain yon. Or, may idea pa ba siya about dyan kung ano yon, diba? So, if the client provides a literal explanation of the proverb and cannot interpret its meaning, so abstract thinking abilities are lacking. Ayon. So, when the client continually gives literal translation, so this is evidence of concrete thinking. Okay, example. Ano nga yung sample natin kanina? Example, people who live in glass houses shouldn't throw stones. Diba? So, yun yung proverbs natin. People who live in glass houses should not throw stones. Okay, so yung abstract meaning ano, don't criticize others for things you also may be guilty of doing. Okay? Pero yung literal meaning niyan, literal translation, if you throw a stone at the glass houses, the glass will break. Okay? Yun yung tinatawag nating concrete thinking. Okay? So, yun, kadalasan meron ang patient natin. Okay? Kung hindi niya kayang kung wala siyang ability doon sa ating abstract thinking. Okay? Ability to explain. Ayan. So, the nurse may also assess the client's intellectual functioning by asking her or him to identify the similarities between pairs of object. Diba? Similarity of object. So, what is similar about an apple or an orange, 'di ba? Or what do the newspaper and the television have in common, 'di ba? Halimbawa yung mga news, yung mga ganun. So, kung kaya ni patient i-identify yung similarity, so yan, maganda yung paano nga ba natin masasabi yan? Yung way of thinking ng patient natin. So, ayan. About sa information and intelligence. So, with the patient has this high intelligence or low. Okay? Judgment and insight. So, for the judgment and insight, we have judgment, decision making. So, is it good, fair, or good, poor, or impaired? Okay? Or with the insight. With the insight, understanding of the nature of problem or illness. Is it good, poor, or impaired then? So, ayan. So, when you say judgment, it refers to the ability to interpret one's environment or situation correctly. Diba? And to adapt one's behavior and decisions accordingly. So, ayan. So, magkasunod yung judgment natin. Or, ano pa, ability to assess or evaluate situations. Diba? Make rational decisions. Ayan. Ano pa sa judgment? Understand consequences of the behavior. Ayan. And ito talaga yung take responsibility for actions. Diba? So, yun yung judgment. So, problem with judgment may be evidence as the client describes recent behavior and activities that affect a lack of reasonable care for self and others. Example natin. Sample. So, the client may spend large amount of money dun sa mga hindi naman mga necessary, okay, such as food and clothing. Ayan. So, risky behavior such as picking up mga strangers na mga pinapasakay natin, hindi naman natin kilala, di ba? We are not really that sure. Okay? At kung anong mangyari. So, those are unprotected or masasabi nating may poor judgment. Okay? So, the nurse may also assess the client's judgment by asking the client like mga hypothetical questions. Diba? Halimbawa, pag nakakita ka ng pera, anong gagawin mo? Diba? Yung mga ganon. So, judgment. So in here, for the judgment and insight, there is this ability to solve problems and make decisions agad. Diba? Example, what are your plans for the future? Okay? Sabi na patient, there's no future. Ayan. So, what do you plan to do to reach your goal? Diba? So, sabi ni patient, I don't have a goal. Ayan. Tapos, ang usapan. Pwede about knowledge about self. Awareness of limitation. Or awareness of consequences of action. Diba? Or awareness of illness. Diba? Do you think you have problem? Or do you think you need this treatment? So, ayan. Okay? So, yun yung ating judgment. Okay? So, halimbawa naman sa ating insight. Insight, it's the ability to what? Ability to understand the true nature of one situation and accept some personal responsibility for that situation. So, this is the ability to perceive and understand the cause and nature of one's and other situation. Diba? So the nurse can frequently infer insights from the client's ability to what? To realistically describe the strength and weakness of his or her behavior. Example, sige nga, example natin of the poor insight. Example of the poor insight would be a client who places all blames of others for his or her own behavior. Halimbawa, ganito. Ito yung malala eh. It's my professor's fault that I failed the exam because she did not provide the PowerPoint presentation. O, diba? Ang galing. Sinisi si professor. Ayan. So, ayan. So, another example of poor insight would be, for example, the client who expect all problems to be solved with little or no personal effort. So, the problem is my medication. As soon as the doctor gets the medication right, I'll be fine. Ayan. So, sino sinisi na naman niya? Si medication, no? So, ayan. So, the client is not accepting responsibility for his or her failure. So, yun yung sa insight natin. Okay? So, yun. Question, judgment, and insight. Okay, so that was our last. Thank you. And do you have any questions? Ayan. So, thank you very much. I hope you understand, or if you still have queries, you can ask questions.